My name is Abdullah Ihsan. I'm a patient with primary cellular dyskinesia, and I volunteer as the Treasurer and Patient Rep for PCD Support UK. I am also the member of the ELF Patient Advisory Committee, and with me today is Helen, and I'll let Helen introduce herself.
Hello everyone, and thank you, Abdullah. My name is Helen Parks, and I am a member of the ELF Council, as well as a member of the COVID-19 Patient Advisory Group, and I also chair the United PAG, and it's wonderful to be here today. I have a very keen interest in healthy lungs for life and promoting lung health, especially given my own struggles with asthma. Abdullah.
This afternoon, we'll hopefully split into 2 breakout sessions. This is your chance to share your experiences, challenges, and ideas. And then the second session will be about the actions to actually drive forward those changes. But before we tell you a little bit more about that, let's head over back to Chiara, our visual artist, so she can show us the progress of what she's been doing today. I think it's looking amazing. You can really see the progress of the different talks that we've had today, and we'll come back to this later on today to see the finished product. In terms of the breakout sessions, I hope everybody's found their seats and they're in the right area. If not, feel free to reach out to any of the ELF staff, and they should be able to help you find your seats. But before we actually deep dive and Helen explains a little bit more around this, let's just watch another advocacy video reel from the patient organizations, just to set the tone a little bit of the afternoon sessions.
Dear friends and colleagues, I am Lilia Bianca-Janté. I present the FFRER. It's a French federation of patient associations, patients with respiratory diseases. You know, tobacco is often a cause of respiratory problems, and the fight against tobacco dependence is a complex question. The necessary conditions are the awareness of the role of tobacco and of addiction treatment, and also the access to this treatment. During last years, our federation realized all occasions to present the patient view, mostly COPD patient, of this problem in the form of small studies, interviews, presentation, medical congresses, national, international, also awareness days, our events, elections of deputies. We added different coalitions against tobacco. We became a member of a national committee against tobacco, and results of our calling role. Now in France, we have regular companies of awareness of the role of tobacco dependence and reimbursement of replacement therapy prescribed by doctors and nurses. Next step is to include the pharmacists as prescribers for this treatment, for really facilitate the access to this help to be continued. Thank you very much for your attention.
De políticas públicas orientadas al paciente y la atención en salud es fundamental para garantizar la calidad, accesibilidad y sostenibilidad de los servicios en salud. Nosotros desde la Fundación Colombiana para Cáncer de Pulmón, Asma, EPOC y otras enfermedades respiratorias y oncológicas creemos y trabajamos activamente en la participación del paciente. Las políticas deben promover y respaldar la participación de los pacientes en las tomas de decisiones sobre su atención médica. Esto puede incluir pues, la capacitación de los pacientes para que sean defensores efectivos de sus propias necesidades, así como la incorporación de la retroalimentación de los pacientes en la toma de decisiones a nivel institucional y gubernamental. Debemos tener un acceso equitativo. Las políticas deben abogar por el acceso equitativo en la atención médica, independiente del origen étnico, la situación socioeconómica o la ubicación geográfica. Acá hay algo supremamente importante que debemos entender todos, y es que las cifras tienen rostros, y esos rostros tienen unas familias que buscan también un enfoque en resultados y calidad. Nosotros desde Inspira hacemos parte de esas políticas públicas orientadas al paciente y su atención en salud. Trabajamos de la mano del gobierno, de las sociedades científicas, de la academia y de todos los actores para poder lograr seguir celebrando la vida. Muchas gracias.
Hi, my name is Caroline Novak, which is a global network of subfield triage patient support groups. Subfield triage was first prepared in 1948, and for many years subsequent to that, patients and their families were told that it was fit for birth with no long-term health issues. Unfortunately, it's become clear that many do have respiratory and morbidity long-term. Our top tips all involve collaboration. Firstly, collaborate with your fellow charities and patient support groups. EAT is a consortium of national and subfield triage charities, which are all quite small because it's a rare disease. Joining together as a group has led to us being invited to take part in European and national healthcare organisations which provide policy. Secondly, collaborate with patient support groups with similar aims. In the UK, there's tasked with collaborating with other paediatric surgical anomaly charities to take part in Get It Right First Time, which is an NHS policy to improve paediatric surgical care. Secondly, we're working with these same charities to apply for highly specialised service status and develop good paediatric specialist care for the rarer end of our condition, but also long-term good transition and good adult care, which is lacking at the moment. Secondly, collaborate if you're invited to take part in European medical organisations such as ERS. We were initially invited to take part in this, but this has leapfrogged on to being part of EURORDIS and ERN Lung and other international organisations. This allows us to influence policy as well as patient-driven healthcare, and allowed us to meet not just other doctors, which is crucial, but also government members, because of our access to these doctors and my sympathy get improved. Finally, take part in research. We've long done this as a nationally and internationally with group. Our national organisations are often the main national database for those form of esophageal seizure, and healthcare practitioners want access to that for research. We're now not just facilitating this process, but being a more active member of research and are now co-actors on some large projects. This furthers patient-driven healthcare and also allows us to develop greater networks of healthcare practitioners that are aware of the condition, aware of our patient support group, and well disposed to us.
Just a huge thank you to everyone who contributed to the video reels, which I know will help and inspire our discussions this afternoon. As I mentioned before, there's going to be 2 breakout sessions this afternoon. The first is going to be to explore more the challenges we face around driving policy. And then the second session will have a short break in between, and then that will focus on the solution that you, ELF, ERS, could take to meet the challenges identified. I'll pass on to my co-chair, Helen, who will give you a bit more of a further understanding on the about the breakout sessions.
Okay, So, for our first discussion, we are going to explore the challenges and issues that patient organisations face while trying to drive meaningful changes in policy and improvements in healthcare. There are 5 different topic areas being discussed in different groups: disease visibility and awareness, access to treatment, climate change and air pollution, digital health and AI, and finally, screening. And there are also breakout groups for attendees joining us online. I will give the instructions to our online attendees first. So sorry for those in the room. Just a moment. So online, all online attendees, you will now leave this live stream and join a Zoom meeting for your group discussion. This is only for those who registered in advance. If you've just joined the live stream today but did not register, you cannot take part in the discussion groups. Sorry about this. However, you can rejoin the live stream at 3:05 today for the plenary session. The Zoom link has been emailed to you in advance by Claire Williams and is available in the live stream platform. Join the Zoom where Claire will be waiting for you. When you're in the breakout room, Claire will lead the discussion and you have 45 minutes for this. As I said, come back at 15:05 for the plenary. Click the Zoom link now. And for all of you in the room, at each table there is a facilitator who will lead the discussion and a note taker who will capture your input. We will catch up with the main challenges identified from each group during the plenary session. This session will focus on challenges, and at the end of the session, we would like you to select one major challenge that you have discussed to share with the wider group in the room. You will write this onto the sheet of paper on your table, which has a jigsaw piece on it. The challenges will be taken forward for the plenary session. Abdullah will let you know when you are halfway through and when there are 10 minutes left. Please remain seated after the discussion for the plenary session. Over to you.
Welcome back, everyone. I hope you enjoyed the chance to hear each other's experiences. We'll just share some of the key challenges that each table and also online have identified in each topic area. I'll hand over to Helen, who'll start off.
I must say it was great walking around the room to hear the different discussions, and yet the commonality across the room on our different challenges was really quite remarkable. So I'm going to look at access to treatment from 2 tables, and also from one of the from the online group as well. And it is quite staggering that despite the fact that we are in here and also online, that you were able to see just exactly and come up with exactly the same problem. So, for example, in access to treatment, table 6, it's almost as if you had an ear listening to what the online group were saying, because you've nearly an identical challenge that you have come up with. So the key theme coming out is that access to care is not the same across Europe. And table 6, you really highlighted that there's national, regional, and local differences in access to treatment. And if that isn't difficult enough, it really is especially inequitable when it comes to funding. So in one country versus another, or even in one locality versus another, the treatment is not always the same, access is not always the same, and the funding certainly would appear to be very different. And I was just listening into someone from Ireland, from the south of Ireland, talking about what was happening there and access to treatment there versus myself, where I live in the north of Ireland, and hearing the huge differences in treatment and access. So that was really quite remarkable when listening to that. And Table 5, you came up with something, and I think probably many of us have felt this at a time, where as a patient we've felt invisible, that perhaps there's a lack of interest, our voices are not being heard, even a lack of support for the challenges that we face, and worryingly, a lack of access to information. And this is especially true if your condition is a rare one. So I was listening to another table talking about asthma and COPD as if they are exactly the same, and yet there are so many variations in asthma and asthma treatment plans along with COPD and the variations there. So fabulous feedback. Thank you very much for that, and I'll hand back to Abdullah.
Yeah, so just to talk a little bit about disease visibility and awareness. The theme in the topics were very, very similar in what the 4 tables here and then also 2 online kind of came up with. And the 3 points that I kind of picked out, one was lack of data, and the other was lack of cost and understanding of what a rare disease is and visibility of rare disease in specific countries. And then the final thing was a lack of engagement with clinicians and patient groups. I'm going to just go through a little bit, just table by table, and I might pick on a few tables just to kind of feedback a little bit. So from table 1, they spoke about lack of long-term stakeholder engagement, so between patients, the public, the clinicians, the government, etc. Louise, from table 1, if you can just stand up and just add on a little bit.
Sorry, you got us on the spot. So do you want us to provide a little bit more why we focus on our topic?
Yeah.
Yeah, so actually we identified as the different groups like media, policymakers, general public, and even healthcare professionals in some situations. They only unfortunately pay attention to the condition when a patient is dead. So it kind of creates a news, very sadly. And so we started, we hope, the discussion later in the afternoon, how do we keep these problems, this patient's struggle, constantly on the radar of the media, of the policymakers, and yeah, that was our focus.
Thank you. And then just moving on to table 2, they spoke very much about the information exchange, so the exchange of data, understanding from the healthcare professionals in comparison to the patients, and then also the time, cost, and effort of actually being able to take part in making the awareness available in especially a lot of countries where there's low income, etc. Ellie, if you just want to add on a little bit just on that.
Yeah, sure. Yeah, so our table spoke a lot about how difficult it is to communicate with all the different groups that you need to work together, and that somehow the information isn't getting through. I think, Nicole, are you sure? But yeah, that's what, and there was different organizations and different people that people were trying to work with, but they did find it quite difficult, and that they all wanted different things. So really similar to what Polina was saying about, you know, some politicians may want the emotional patient stories, some people, they want the data, some people are more concerned with costs, so it's knowing who you're speaking to and what, yeah, being prepared for all, yeah, occasions, I guess, and all the different people is quite difficult. that right? Have I got it? Anything else? No? Okay.
All right, thank you.
Okay.
Now, I am picking on tables, but people don't have to add if they're not comfortable, that's fine, but it's just more to give a bit opportunity for people to kind of talk and kind of give their feedback. And then at table 3, they put down in large letters patient voice, and being able to empower and give them independence and give them ability to engage with, from what I understand, with patients, other patient groups, and then also healthcare professionals and the government bodies, etc., that might exist. But if anybody from table 3 wants to add anything, feel free to.
Okay, so here is table 3. We had a really lively discussion here. So what we came up as a theme for our table was that we really want to see a patient voice, and found out that patient story really makes a difference in any kind of advocacy work, any kind of advocacy process, but also work with healthcare professionals, and really saying before actually patient is dead, okay, I have an issue, and these are the options that I really need to be able to access the medicine, access to equal care for everybody across in the countries, but also across countries. Knowledge about certain medications and how can they get them, and so on.
Thank you. Weirdly enough, I've got these in order. Next is table 4. Raise awareness. So they said that raise awareness to ensure equal access everywhere to the best treatment known and care, and also reimbursement for these medicines and care. Table 4, anybody want to?
Thank you. Yes, of course, that's very important. But of course, our discussion very easily went to a lot of issues. And so, for example, about post-transplant management, which is a huge issue which is not really done today, or, of course, not equal access even in the same country or in Europe is a big issue to bring a disease in first line, and all these issues. We have, of course, ideas for the second part of the record session, and we will talk about that a little bit later.
Thank you. And then we had 2 online sessions who actually brought up 2 quite important points. One being a lack of understanding of rare diseases, or not classified as a rare disease in certain countries. And then the second point being a lack of registries and reference center points. So we don't actually know the number of patients that actually exist within the different areas or around the world. But yeah, I'll pass back to Helen for the next topic.
Okay, so the next topic was climate change and air pollution. So pretty important, especially given what we were discussing this morning. And Table 7 summed it up fabulously by saying this is a complex issue, and it certainly is. So thank you. And I think, but what you did say, which I heard and listened and thought was a key point, that it is so challenging to compete with short-term economic issues, which seem to be gaining more attention. And perhaps I'd ask Table 7, someone from Table 7, just to elaborate a little bit on that for us, please, if you wouldn't mind.
Sure. Yeah, we had a lively discussion here as well, but we did seem to come back to the problems that it's hard to put the health argument next to the economic issues and to compete with it, but also to the short-term political advantages of advances for politicians to really make a point out of this. We know politicians are there for a short period of time and they need their votes, and this is a long-term issue. So we have the economic part, but also the short-term political part.
Yes, thank you so much for that. And I think I'll just mention something which in the United Kingdom, the last government talked about introducing legislation to ban vaping. And of course, the last government has been replaced by a Labour government, and therefore that legislation never made it through Parliament. And do we start all over again? So that really feeds into what you were saying, those short-term issues which particular governments raise, and yet they never see it through to the final piece that's so important for us all, and that is giving us clean air to breathe. So thank you for raising that. And then on to Table 8, and this is, I suppose, a new and evolving issue for us, digital health and AI, and probably has become more important in the post-COVID era. And I think you have put it very cleverly when you say that it's something that's complex to navigate because of the health data involved and the importance of digital health and how that differs across different countries. Perhaps someone from Table 8 would like to take that point a bit further. Thank you.
Please. We looked at several situations where medical data were used, and we concluded that navigating the complexity of health data in digital health is very difficult. That has to do with different history, with protection, with standards, EU standards, complexity, and foremost with trust.
Thank you. Back to Abdullah.
So the final topic is looking at screening. And the point that they made here was that there's lack of awareness and knowledge of the potential value of screening. If I can get someone from Table 9 to kind of just elaborate on that a little bit.
Okay, so we also had a lively discussion, of course, because we all have, we are representing the different diseases, but of course the main problem with the screening is mostly the same. So we narrowed it down to the lack of the awareness and lack of the awareness about the diseases, and also lack of the awareness about the benefits of the screening program. So that's why in all our countries, for all our diseases, we have we are missing the early diagnosis, early screening, because of the lack of the knowledge and lack of the awareness of the benefits of the screening program.
Thank you very much. Just a huge thank you to the group facilitators and the note takers for their support. And now with that, we can bring the plenary discussion to an end. Before we take a short comfort break, just would like to take a group photograph together, so if we can get everybody to come up to the stage before the comfort break kind of starts, and then after the photo, everybody can take it. We will come back at 3:30 for the action planning breakout sessions, and the online attendees, please use the same link for your second discussion group. The live stream for those that can't join the discussion groups will return at plenary session at 4:15. Thank you very much.
Can I have everyone's attention, please? Thank you. So, welcome back, everyone, and I hope you enjoyed your chance to chat again and to have very fruitful conversations. There's no doubt there's incredible passion for advocacy in this room, and it's so encouraging. I'm just going to hand over to Abdullah.
Now is, before we go to the plenary, it's my pleasure to introduce our speaker from the ERS, the ERS President, Monika Gappa. Professor Monika Gappa is a respiratory pediatrician based in Düsseldorf, Germany. Her main areas of interest are early origins of lung disease, severe asthma, and allergy in childhood. She is this year's ERS President.
Well, thank you very much for giving me the opportunity to speak here at the ELF Patient Networking Day. And some of you, I think I've seen before, and some of you might have seen me. We welcome you all to ERS Congress in Vienna, and I really appreciate that you took the journey to come here and to work together and together with the European Lung Foundation. You are here because you all agree, I guess, that it's increasingly important that we work together, respiratory health, respiratory disease specialists and patients, in order to get things moving and get them in the direction you need them. My mission as pediatrician is to promote prevention, and I think we have achieved quite a bit over the previous months. If you walk around Congress and look at the sessions, then you will see that prevention is a topic everywhere. We know that we have to start in children or even in pregnancy to protect lung growth and lung health throughout life. And we can only do that being heard if we work together with you. And you might have seen that on our social media. One thing I'm especially glad about is that we initiated, not me, but the European Lung Foundation, Pippa Powell, together with the people in the Sheffield office and in Brussels. We initiated a European Lung Foundation youth group, and actually the representative of the youth group was speaking at a parliamentary event in Brussels. And I think this is the way we have to go. We have to work together to speak about the issues that need to be addressed in order to improve lung health and improve the life for those who already have respiratory disease. So it's really great that you are all here. We need your input, and if you know young people who want to contribute to what we are doing, that would be really, really appreciated. So I hope I can meet some of you during our opening ceremony, which will happen at 6 o'clock tonight, and then maybe during the Congress again. So thanks again for coming, for contributing to our mission, and I wish you all the best.
Thank you very much, Monika, for sharing your thoughts with us and the importance of our involvement as patients. So you have been good at giving us challenges, and I hope you're as good as giving us solutions to some of the challenges we face. So Abdullah and I, again, are going to look at some of the areas that you've been discussing, and we're going to call on you to perhaps elaborate a little bit on some of your areas. So I'm going to look again at access to treatment. And I think the common theme is the importance of collaboration. And therefore, it's almost a call to action that we come together to help each other across the range of lung diseases. So table 5, I'm coming to you to see if there's anything more that you would like to add on the importance of collaboration to ensure health equity.
Yeah, thank you. We had a quite difficult discussion, and finally we found that the collaboration is therefore so important because of the lack of health equality and equity across Europe, not only across the EU. So, and we see the only chance to put all the competences and resources together amongst clinicians, amongst researchers and our patient community to reach out for more, because it's mainly on voluntary topics. It's not, there is no higher institution who can force anybody in the national health system to obey our rules. So it's about collaboration, convincing and advocacy.
Thank you. And how true is that? If we are all in this together, then we all can win, and we can all hopefully bring about change where we can help each other to see the benefits of the importance of our voices, our collaborative voices. Table 6, you also talked about the importance of working together and how ELF can help small organisations to advocate for themselves, to access funding, and importantly, to access training. And I know that ELF is very, very keen on giving support to help us all become patient advocates. So again, I'm going to come to table 6 and to ask if you would like to elaborate on what you have just shared as your solution.
Well, I think it's a fact that some little charities do not have a person that knows politicians, how to reach them, and they cannot make advocacy at this local politician level. And I think that from the European Lung Foundation, it could be interesting to know the problems of their members, local members. Maybe some charities do not need such help, but there are many others that maybe don't know how to press politicians and how to reach them to just, they know what the problems are. So maybe ELF could help that.
Thank you. And over to Abdullah.
Thanks, Helen. In line with what Helen spoke about in collaboration, that is something that across the 4 tables for disability, visibility and awareness is a very common theme. Whether it's looking at collaborating with different patient support groups, or it's looking at collaborating with different stakeholders like healthcare professionals, or even setting up specific days for general patients to come together and talk about visibility and awareness in itself. Table 1 spoke about bringing together patient support groups to promote lung health checks in spirometry, and then also open dialogue with publics, patients, doctors, politicians, etc. If someone from table 1 can elaborate a little bit on this.
Thank you so much. So just to provide a little bit of our trace of thought. So we're here representing different conditions, different lung diseases with different priorities. And first, we're sharing our all individual challenges, but then we decided that actually, if we want to bring all the stakeholders on board, we need to have one voice of respiratory community first to maximize the visibility of respiratory. And then we try to identify what kind of intervention or what kind of measure would be able to encompass and bring together different stakeholders. For example, we discussed about different diseases that we know. For cardiovascular diseases, we can measure blood pressure, for diabetes, glucose levels. And then we started all spontaneously mentioning spirometry. And so we thought about that as both as a companion opportunity, but also as a diagnosis opportunity that can bring together both patients, health professionals, general public, politicians, media. And then we tried to outline how to make it attractive, or why is it attractive to each of these groups. So for general populations, we talked a lot about early childhood and the prevention, but also early diagnosis for adult population potentially, and for patients, for people with already existing respiratory conditions. Then we talked about the insurance, who is going to pay for this. So how do we make it attractive, cost versus quality of life? And for politicians, again, the cost argument, it's a very cheap intervention that might have a quite short-term effects already, that they can still show during their mandate while they're in their offices how it had effect. Then we talked a little bit about healthcare professionals, and that's very important to bring them on board and to make sure that existing guidelines change, that they encompass the spirometry, they bring the spirometries there as a routine procedure. We discussed that there's a little bit of an issue with the evidence, and more research is needed to make sure that this intervention can be promoted and supported by all the stakeholders. And then with the media, once we make this intervention attractive to all these groups that we mentioned before, it's inevitably going to be more like a buzz in the media as well. It will multiply effect. And then what we hope will happen, that will be an individual-driven initiative where everybody can say that this is my right to know the volume of my lungs, to know the status of my lung health. Thank you.
Thank you very much. Just to pick on one point you mentioned at the beginning there, was to look at having a single voice across the different patient support groups, and that's what Table 2 have kind of got down in their point, is to build a coalition to be able to collaborate and find common ground between the key stakeholders. If I can get somebody from Table 2 just to elaborate a little bit.
Hi, yeah, I think I've just been nominated here. So I think we really discussed finding commonality. Sometimes in our health area, there were such different competing priorities from all the different stakeholder groups that initially it looked like it was almost impossible to find that common ground. But after discussion around the group, we found out that there's always going to be some commonality there, and then setting out what that is was really important. And then how ELF can support that, we then discussed about sharing best practice. So where we had found that commonality and we had brought people together, how as a group we could come together and share that. So I think that's covered.
Thank you very much. Table 3 spoke more around patient stories and gathering data to then be able to create a synergy around the world. If they can elaborate a little bit on that, and just to add.
Unfortunately, I think that's fallen to me. Well, we did talk a lot about what Table 2 and also Table 1 talked about. We're very much focused on the patient today and the patient's voice. And we talked about how we know how powerful the patient's stories are, but also how difficult it can be for the patient to do that. And we want to create an environment in which the patients feel that this is completely normal to be able to talk about their health condition. We want to be able to give them the knowledge, the confidence to be able to do that so that they can advocate for themselves and create a synergy so that everybody is basically singing from the same hymn sheet. And I think that's where ELF can bring all these small organisations together, and whilst we all might have different lung conditions or respiratory conditions in the room, there is an awful lot of cross work. One of the best practice idea, I think Table 2 just mentioned, tips and advice. We think ELF can definitely support us in that, and having that. You probably already have it on your platform, but maybe make us more aware of it, and we can use those to help us with the policymakers. Some of the small organisations I think they talked about over there, we have no idea where to start in our country, so that's really important. And also another key message that came out from this table was making the policymakers understand what it feels like to be us. So to get that experience, however you want to do that, whether you want to put clips on their noses so that they can't breathe properly when they're going up the stairs or riding a bike, etc. If they can understand what it feels like to walk in our shoes, then that's quite a powerful tool as well.
Thank you very much. And following on from that, collaboration and a focus on patient involvement. Table 4 have also spoken about an idea to set up a World Respiratory Disease Day supported by the ELF and open it to everyone who wants to join. This is to raise awareness on the unmet needs of the patients with respiratory diseases. For example, access to treatment and care, multidisciplinary area, and education on respiratory diseases as a whole. If I can get Table 4 to just elaborate a little bit, and anything I want to add.
Thank you. Of course, all these problems, first we started, it's a problem of time and of money to create awareness, and then we thought about how to collaborate and to get in synergy these enormous difficulty for small associations to get linked in big structures in a certain way to get help in communication in accountancy. And then came up the idea that perhaps we could ask ELF ERS to create not a World Lung Day, but a Global Respiratory Day, which is focused on awareness of all associations, for all members, but also associations in lung health that are not members, and to create a moment to focus on small and on big ones, to help and to give the possibility to small associations to learn more and to get help from these structures and to get rid a little bit of this approach to find some money for the next year, which is also a very big problem. And we think a Global Respiratory Day might be one of these effective solutions. Thank you.
Thank you very much. I think as a whole, from both topics, access to treatment and visibility, we can look at collaboration as key here for every aspect. But for the next topic, I'll let Helen add on.
I almost felt sorry for Table 7 as I was listening in on their conversation, and perhaps they've got the most challenging topic today, climate change and air pollution. And it's hard not to feel pessimistic given the situation in our world in terms of pollution, and especially the impact of that on all of our lungs. But they fought through it, and they came out and they managed to find something which is key to everything that has been said so far: together. Together we can make a difference. Be resilient, work together, measure the impact, take it more seriously, and more advocacy actions. But to sum that up, together, and I'm going to come to Table 7 because I think you probably can put that more eloquently than I have just done.
I'm not sure about that, but you're right, we got a little pessimistic and sometimes a little depressed, but on the bright side, we also believe that we already started a sort of a movement, since the health argument in this discussion is gaining some support by policymakers. And therefore, we believe that we need to continue our work in educating and be resilient and work hard on this topic. We also realize that we're separate as organizations. We're small, so we need to build a coalition, and we should accept the invitation by the WHO to engage patient and patient organizations in this discussion. So I think that's pretty much what we discussed here. So we believe that by working hard and believing in it, and also try to find a way to engage the younger population, because they're the few. This is work which needs a very long breath. Right? So we should engage them as soon as possible.
Thank you, and absolutely, and it's great that ELF now has a youth organisation as part of it, and they are our future. And I think leading that from that takes us straight into our future with digital health and AI. And once again, it's patient involvement, which is absolutely key. Working together with ELF and perhaps an ELF working group to support the actions which we need to take. And I'm sorry I can't get to table 8 to ask you to go a little bit further, but I hope I have summed up because we're running short of time on this. But once again, I think very powerfully this afternoon, we have all shown how important it is for all of us together to collaborate and to ensure that the one thing that we all have in common in this room is that we all have lungs that we need to protect. And it's not just in this room, we all in the world have lungs, and we need to somehow encourage others to focus on the importance of healthy lungs for life. So finally, I'd like to thank the group of facilitators and the note takers for everything they've done today and also during this session as I bring it to an end. You'll be glad to know that ELF will write up a summary of all of our discussions and it'll be shared with you. Over to Abdullah.
Now it's my pleasure to introduce another speaker from the ERS, which is the ERS President-elect, Silke Ryan. Professor Silke Ryan is a consultant in respiratory and sleep medicine at St Vincent's University Hospital, Dublin, and is an internationally renowned expert in respiratory sleep disorders, such as sleep apnea. Silke is the current President-elect of ERS and will take over from President Gappa during the ERS Congress next year. Over to you.
Yeah. Thank you so much for allowing me to say hello to you all. It's such a great pleasure for me to be here, and it's fantastic to see how many of you are here. And I just came in at the end of your session, but you actually, the positive vibe is so palpable, and that's fantastic. I mean, the relationship between the European Respiratory Society and ELF is unique and great strengths of both for both of our societies, and certainly very special to me. I mean, people who are living with respiratory conditions are in the center and at the focus of everything what we do, like in my clinical practice, at research, in our guideline development, and in our education of our junior doctors. And frankly, my clinic would also be pretty lonely without the person at the opposite side of the table. So I don't think I need to remind anyone here in this room that the burden of respiratory diseases is enormous. And we simply cannot stop advocate for solutions, for improvements. And I certainly vouched as incoming president of the European Respiratory Society, I will work very hard with all possible stakeholders, and particularly with all of you, for our common mission, which is to alleviate suffering from respiratory diseases. As a respiratory physician working in a large teaching hospital, I see a wide variety of respiratory diseases. I do have a special interest in respiratory sleep disorders, and during my term as president, I will specifically emphasize the enormous burden of respiratory sleep disorders, which is a little bit forgotten in the whole aspect of lung diseases. Respiratory disease is also a bit more than just lungs. Obstructive sleep apnea is one of the most common conditions in from respiratory diseases, and actually, in fact, about 1 billion people worldwide suffer from this condition. And this is a topic which is still largely under-recognized and unaddressed. So there is a lot to be done, and it's such a great privilege of serving as incoming ERS President for our purposes. I'm really looking forward to hopefully meet as many of you personally, either during the Congress or afterwards. I hope I see as many of you at the Lung Run on Tuesday morning. And my God, guys, I need you to push me over the line. I mean, 5K at 7:30 in the morning. Right, good. But it is for an amazing purpose. It's for healthy lungs, healthy sleep. So I wish you a wonderful time at the ERS Congress and in this beautiful city of Vienna. And as said, I'm really delighted that you allow me to say hello to you.
Thank you, Silke, for joining us and sharing your future vision with us today. I now pass back on to Helen.
Thank you very much. I would now like to ask Demetrius, our ELF chair, to come to the podium to give his closing remarks and to wrap up today's events. Thank you very much for allowing me to be part of today, and many thanks to you for participating. Over to Abdullah and then Demetrius.
Again, just to reiterate, thank you. It's been a great day, and many thanks for everyone for participating. Over to Demetrius.
Hello. Already finishing, eh? So, where are we? Let me keep my notes. We have tell so many things. Can you bring my phone? I have made some notes, Dimitra. First of all, thank you, Helen. Wait. Abdullah, what is the other name? Abdullah?
Ihsan. Abdullah Ihsan.
Ihsan?
Yeah.
Abdullah Ihsan?
Yes.
I like every time to learn new names, new countries, new friends. I hope you invite us also to have some vacation there. Already a big day, a safari day. A lot of times I used to describe it. Is coming to an end, and I feel that is a lot of time, an opportunity of meeting patients with experience, and I describe it as a gold box, that is full of information and full of possibilities to make better change and to better understand what is the problems and what is the solutions. I have kept some notes of very important and useful things that we listened today. One was about clean air, that of course should be a priority in policy change. And if we do it right, we can decrease the burden of respiratory by 25%. So it's a number that we can achieve it. Also, health policy change, of course, cannot happen without patients' involvement. But we know already this. But it's very important when Barbara Hoffman, the ERS advocacy chair, and the scientists understand and highlight the importance of being involved. And I could add not just to be involved, like Hilde told in a presentation, to be patient-driven, not patient-centered. It's a huge difference, a small difference in the words, but a huge difference in action. Also, Hilde make another nice comment that when I becomes we, illness become wellness. Such a true story. And finally, the fourth note that I have kept is that in the afternoon brainstorming that we have a discussion, we highlight some common fields like access to digital health is priority, screening, early detection, visibility of lung health, because a lot of times it's not obviously what is the problem, what is the solution to the problem. And of course, we need to have a multi-stakeholders work together and not only patients, okay? So, before we finish, we can give some homework or some channels to work together. And what is these channels? We will describe three channels that we can work together the year that is coming and to come up next year to see what we have achieved. I don't know how many of you know IRC, International Coalition. There is a stand there that you can find more information. If I want to state the biggest highlights, is that international respiratory coalitions and the patients, together with doctors, can make national coalitions and national strategy plans. You can take some money to achieve this. I don't know if you have already registered. And they have a useful tool that is lung facts. Where it go? Oh. Okay, and they have useful tool, lung facts, nationally lung facts, and now they have a better version with more countries that it's a tool that you take data to make a better advocacy. And I think today or tomorrow they have a meeting from Ukraine and Australia coalition to get some ideas in order how we can do in our countries also. Austria, yes, sorry. Ah, yes, Austrian. It's big. It's a long distance between Austria and Australia. Okay, the second channel of action, MIP Lung Health Group. As you already know, we have elections, we have new groups in the European Parliament, and this is the opportunity to find your national MIP members and to start pressing them and to express them what are the opportunities to make better policies around lung health. Oh, sorry. How can we go back? And the third channel is about WHO, that we have the privilege from Maria Neira to be there, and with the tool of lung days. How was? Ella, go one slide back, please. There is funding opportunities and campaign opportunities also to work in national level to having better lung health. I don't know if I make it worse or you have learned better before, but my bad English, I always say, it's an opportunity for you to feel that there are no borders, even if you don't speak good. So I don't know what you have learned today, but we can make a poll, a self-measurement poll, to see what we have learned or if we feel better today, if we have a better score. So if you can scan with mobiles, if you don't have a Nokia, old one without screen. Okay, some seconds, we can start voting. I hope you will learn something today. Much better, eh? Everybody from 6 and above. So it gives us hope to make it better the next year. But as we promised, we have a visual artist this day, and I think we can go briefly to Chiara to see what are the important things in images. We will go or not? Oh. All of this happens today. Healthy lungs, it takes two sides. Pulmonary hypertension, COPD, different diseases, challenge and action. This is business plan also in drawings. Eh? Okay, perfect. I think we want a photo and all together finally at this photo. Thank you very much, Chiara. I don't want if you have some seconds to make some photo, but we really need to study it to see what is the progress next year. And if we have some green checks that we do it. Hilde Kaiser, Evi Hadzadreu. Oh, all the names, perfect. Okay, I think now we are in the end of the Patient Organization Day. Of course, we can have a briefly opening before we can see each other before the opening session at welcome reception from 5 to 45, just to grab a quickly drink, and then we can see you tomorrow in our stand that we have from tomorrow and we have separated in some sections, time slots with different topics. So it's the better place to get connected and to know us better. So, coming to an end, I would like to thank you, the co-chairs, that they have made a brilliant job today. You already know that Michaela Odemir, Ed Powell, Helen Parks, and Abdullah Hissan. Thank you very much, and applause to them. We also have to, I have to thank the technical team that they informed me that they have very good sound and very good images and cameras from the distance. Hello, Europe representatives from the monitors. And this is the end. I think now we have to make a photo. Pippa?
We've had a photo, Dimitris.
You have done it?
Yeah.
Without me? Okay, thank you very much. We'll be in touch as a family, ELF family. Okay, have a nice conference.